everyone, this is Dhruv Kanabar, a third year MBBS student from Dr. N.Y. Tasgaonkar Institute of Medical Science, and welcome to lecture 3. दो लेक्चर हम दोनों ने सर्वाइव कर लिए हैं. Today is the lecture 3 and I'm pretty sure that you're going to love this lecture. This is the actual juicy part of your pharmac. We are going to study about bronchodilators. Previously we did understand that bronchoconstriction is the root cause, so obviously we will give bronchodilators. तो आज bronchodilators की पूरी राम कथा हम लोग करेंगे. And then we are gonna be very well versed with the chapter. फिर आगे हम लोग drugs acting on leukotriene के बारे में बात करेंगे. But today's focus will be bronchodilators. As usual, grab a cup of coffee or a chai, yeah, and then start your lecture. Download my lecture and put your phone on DND. I don't want any notifications. I don't want any calls while you are attending my lecture. Be very focused, be very attentive for those 30-40 minutes, whatever I am taking. Or rather, it is mainly less than 30 minutes to be very honest, so that you're focused. स्क्रीन के ऊपर आपको नोट्स दिख रही है, वही नोट्स आपको टेलीग्राम पे दी जाएगी. And then you will have to revise those notes so that the revision goes faster. Exactly, yeah. And apart from that, you have to be very, and apart from that, you have to solve the fill in the blanks that I'm giving you. They are not just fill in the blank, they are kind of a flashcard for you, so that you retain your information at a much better rate, right? Okay, so let's go with bronchodilators. What are bronchodilators? See, in the acute attack of asthma, if there is an acute attack of asthma, right, you cannot treat acute attack of asthma if you don't have bronchodilators. If there is basically acute attack of asthma, you have to treat it with bronchodilators. Bronchodilators are the most essential drugs. Now bronchodilators mainly, yes please, bronchodilator mainly are of 3 types. How many types? 3 types. One type of bronchodilators are the one which are called as beta 2 agonists. Just bear with me with the names. Yeah. Then you have the M3 blockers. So what are you saying? I'm not understanding anything. Just bear with me. And then you have the third class, that is the phosphodiesterase inhibitor. Rather, I should say subclass. So bronchodilators are of 3 types. One which are called as beta 2 agonists, one which are called as M3 blockers, one which are called as phosphodiesterase inhibitor. What is the collective function of all the 3? Bronchodilation, obviously. So why are we dividing them into classes? Based on mechanism of action. Yeah, yes. So based on mechanism of action which is there, हम लोग ने इनको 3 classes में divide किया. Make sense, है ना? Now होता क्या है? We want bronchodilation, right? And from ANS यानी कि autonomic nervous system में हमने पढ़ा है ये चीज कि आपका beta 2 receptor of the sympathetic system when gets stimulated it causes bronchodilation. So you want bronchodilation and the beta 2 receptor on stimulation is going to give you bronchodilation. So that is why there are certain kind of drugs which will act on the beta 2 receptor and stimulate it, leading to bronchodilation. But then there are other type of drugs which will act on M3 receptor. So what is this M3 receptor? It is the muscarinic receptor present in the bronchus. Yes. On stimulation, that will cause bronchoconstriction, which you don't want. So there are drugs which will go on the M3 receptor, they will act on the M3 receptor and inhibit it. And on inhibition, that will lead to bronchodilation. What about the phosphodiesterase inhibitor? In a while, we will talk. So right now, our main focus is beta 2 agonist and M3 blockers. What are they? They are bronchodilators. Matlab the goal is bronchodilation. What is the mechanism of beta 2 agonist drugs? Obviously, they will act on the beta 2 receptor, stimulate the beta 2 receptor, stimulate the sympathetic system. I hope you know that ANS में, I know we have not started ANS with me, but आपने पढ़ा होगा कि ANS में there are alpha 1, alpha 2, beta 1, beta 2 receptors है ना? तो बीटा 2 रिसेप्टर जब स्टिमुलेट होता है बेटा तब ब्रोंकोडाइलेशन होता है. So these drugs are doing the same thing. They are going to the beta 2 receptor and they are stimulating it, causing bronchodilation. That is why they are beta 2 agonist bronchodilators. है ना? But there are some other drugs which are basically going to the muscarinic receptor, the third muscarinic receptor present in the bronchus. Are they stimulating it? No, they are inhibiting it. That will lead to bronchodilation. That is the M3 blocker bronchodilators. And what about the phosphodiesterase inhibitor? In a while we'll discuss about that. Okay. So in acute attack of asthma, in the acute attack of the asthma which is there, yeah, the condition cannot be treated without the bronchodilators. Yes. So if you want to treat the acute attack of asthma, you need to have bronchodilators. Yeah, there are two types, mainly three, but actually there are three types, or mainly two. One which will stimulate the sympathetic systems called as the beta 2 agonist, and the one which will inhibit the parasympathetic system, that is the M3 blocker को inhibit कर देंगे, that will lead to bronchodilation. समझे? M3 को block करने में bronchodilation, stimulate करने पे bronchoconstriction, but that is not the goal. Okay. So what are the example of beta 2 agonist? Beta 2 agonist: salbutamol, terbutaline, salmeterol, formoterol. And M3 blockers are ipratropium and tiotropium. Ipratropium and tiotropium. Sir, ipratropium and tiotropium, they will block the third muscarinic receptor and inhibit the parasympathetic system. Yes. Sir, terbutaline, salbutamol, formoterol, salmeterol, they will stimulate the sympathetic system. They will stimulate the beta 2 receptor and cause bronchodilation. Yes. Perfect. Hana? Okay. Now we will understand about the beta 2 agonist here. ठीक है? अच्छा, what is the route by which we should give beta 2 agonist and M3 blockers? Inhalational and inhalational route. But when we talk about the phosphodiesterase inhibitor, we will give by oral or IV. Yeah. So if a question arises that the bronchodilators can never be given by oral or IV route, not very true. Usually though it is given by inhalational route, 99% yes, but theoretically you can give it by oral or IV route. है ना? And oral और IV route से किसको दिया जाता है? Phosphodiesterase inhibitor को. Exactly, that is the case. है ना? Okay. Okay, fine. Right? Chalo. Now we will be talking about the beta 2 agonist as I promised. Beta 2 agonist, we have understood the mechanism of action. We also understood the example. Now, it is very important to understand two aspects. One which is called as long acting or short acting, and one which is called as fast acting or slow acting. है ना? है ना? So the drug can either be long acting or short acting and fast acting or slow acting. If I talk to you about salbutamol, it is very fast acting, but it is short acting. जल्दी start होता है action, but छोटे समय के लिए होता है. Same goes for terbutaline. Very simple. Terbutaline is also fast acting, but it is short acting. Yes. But then comes your salmeterol. Salmeterol is slow acting, but it is long acting. लंबे समय तक चलता है. Action slow आता है पर लंबे समय तक चलता है. And then comes the king, the 3-star drug, formoterol. Formoterol is fast acting as well as long acting. मतलब जल्दी भी है और लंबा भी चलता है. Right? Terbutaline and salbutamol were fast acting but short acting. Salmeterol was slow acting but long acting, and formoterol is both. It is short acting as well as it is long acting as well as fast acting. Right? See, in prophylaxis, I want to give long acting drugs. Long acting. But in attack, if there's an acute attack of asthma, I want to give fast acting drugs. If there is an acute attack of asthma, I don't want my drug to act slowly. I want my drug to act fast. Yes. So in the acute attack of asthma, I can give salbutamol, I can give terbutaline, I can give formoterol. But in prophylaxis, I want my drug to go long acting. So I can give salmeterol or formoterol. So in acute attack of asthma, we can give salbutamol, terbutaline, formoterol because of the fast action. But in prophylaxis, yes, please pay attention here. We can give salmeterol and formoterol because of their long action. So prophylaxis में long action, acute attack में fast action. Yes. So do we have any side effects of these kind of drugs? Yes, we do have side effects. The side effects are determined by 4T. है ना? So 4T is the side effect of bronchodilators. Tachycardia is the side effect in overdose. Tremors are the most common side effect. There are some kind of T wave changes as well, which can lead to basically your hypokalemia, and there can also be tolerance. So if someone tells you that what are the 4 T's, what are the 4 T, what is the 4 T that is associated with your bronchodilator, these are the side effects. Tachycardia, when there is an overdose of the bronchodilators. Tremors, which is the most common kind of side effect of the bronchodilators. T wave changes, which can lead to hypokalemia, and your tolerance can develop, right? I'm assuming that you know tolerance from your general pharmac. Yeah, tolerance and tachyphylaxis. Yes. Now, okay. Okay. Now, a very important question is that if it is causing hypokalemia, will it cause hypoglycemia? No. Your bronchodilators will always lead to hyperglycemia but never hypoglycemia. Very important, very important. This is asked in universities, asked in your NEET PG as well. Okay, so with this we have completed the beta 2 agonist and the introductory part of the bronchodilators. Firstly, I told you in the previous lecture that bronchodilators are the best drugs to be given in case of asthma because bronchoconstriction हो रहा है, we are giving bronchodilators. Any acute attack of asthma, can it be solved or can it be resolved if we don't have bronchodilators? No. You need to have bronchodilators to resolve the acute attack of asthma. Bronchodilators are of 3 types: beta 2 agonist, M3 blockers, phosphodiesterase inhibitor. We have not discussed phosphodiesterase inhibitor at all, but we have discussed about the M3 blockers and beta 2 agonist. The drugs which fall under the beta 2 agonist category, they will stimulate the beta 2 receptor. They will stimulate the sympathetic system and cause bronchodilation. But the drugs which fall under the M3 blocker category, they will block the M3 of the parasympathetic system, inhibit the parasympathetic system, cause bronchodilation. In the beta 2 agonist, we have salbutamol, terbutaline, salmeterol, formoterol. But in similar case of M3 blockers, we have ipratropium bromide and tiotropium bromide. Yeah, salbutamol is fast acting but short acting. Terbutaline is fast acting but short acting. Salmeterol is slow acting but long acting. Formoterol, a thumbs up drug, it is fast acting and long acting. In prophylaxis of the bronchial asthma, we want long acting drugs or fast acting drugs? Long acting drugs. That is why we will give salmeterol and formoterol. In case of the acute attack of asthma, we want the fast acting drug, long acting drug, fast acting drug. So we will give salbutamol, terbutaline and formoterol. Will we give salmeterol? No, it is slow acting. Yeah, what are the side effects? The most common side effect, tremors. The side effects seen in overdose, tachycardia. Do we develop tolerance in terms of if we take bronchodilators for a very long period of time? Yes. And what are the T wave changes which will lead to the hypokalemia? Is there hyperglycemia which is caused by the bronchodilators or the hypoglycemia caused by the bronchodilators? Hyperglycemia is caused by the bronchodilators. हाँ जी. ठीक है. So this is, we have completed the first part. Now we will proceed with the second part.